first dose of the Pfizer vaccine for those children who are under 12 is September 30th. And we would like to urge all parents, guardians, and caretakers to please take up the Ministry of Health on this offer. I'd like to now shift your attention to an update on the parallel healthcare system. This morning, the overall occupancy in the parallel healthcare system across Trinidad and Tobago is 33%. This represents 192 patients, of which 180 are considered severely and critically ill, as they are currently in hospital, and there are 12 patients who are currently in the step-down facilities. Those are patients that are recovering. It is important to note that today is the first day since August 14th that the number of patients in the parallel healthcare system is under 200. And just to give some context to some of the dates and some of the trends that we would have noticed, on July 13th, we noticed a trend of an increasing rolling average in the number of confirmed cases. On July 29th, the trend of increasing hospital occupancy was confirmed and noted. And from August 14th to today, we have had anywhere between 200 and 244 patients in the parallel healthcare system. We are hopeful that today's data point is the start of a downward trend with respect to hospital occupancy. At our ICUs this morning, there are 14 severely ill patients receiving care across the parallel healthcare system. At our accident and emergency departments this morning, across 10 accident and emergency departments, there are 19 patients who are severely or critically ill and are being transferred to the parallel healthcare system this morning. Our accident and emergency ambulance usage, that is transferring patients with COVID-19, is at a rolling average of 14%. That means 14% of our total ambulance fleet over the past 7 days is dedicated or has been used for COVID-19 transports. Now, ladies and gentlemen, the hospital occupancy figures and numbers really are a reminder to each and every one of us that our behaviors need to be consistent with the advice provided by the Ministry of Health since the onset of the COVID-19 pandemic. Between the 22nd of July 2022 and the 7th of September 2022, 79.4% of all persons hospitalized in the parallel healthcare system are not fully vaccinated, while 20.4% are fully vaccinated. Every morning, we review these trends and we collect data. Every morning, the health team and members speaks to the medical chiefs of staff and the heads of the accident and emergency departments across the traditional and parallel healthcare systems. And the trend has been consistent. Persons who are hospitalized for COVID-19 and have, adverse outcomes or worse outcomes tend to be those who have several comorbidities, as well as those who are not fully vaccinated. And this is a reminder to all of us that we need to take up on the offer to become fully vaccinated, especially if you or your relative has a comorbidity. Vaccination reduces the risk of you transmitting COVID-19 to those vulnerable persons and those amongst us who cannot be vaccinated, such as young children and persons with immunocompromised disorders. Vaccination also reduces the risk of you and ourselves basically ending up or being treated in an intensive care unit or a high dependency unit. And that's evidence that has been noted globally. We continue to try our best and monitor trends at the Ministry of Health on a daily basis, and this guides our resource allocation. But I'm asking you on behalf of the health team and also as a specialist physician to please continue with consistent good behaviors that you have been practicing since the onset of the pandemic. Please take up the offer to be vaccinated. please consider mask wearing, which is recommended in certain settings, such as in places of religious places such as supermarkets, pharmacies, hospitals, and clinics. And let's continue that trend that we all started in terms of sanitization. As I close this morning, I would just like to commend and recognize the health teams at our various RHAs across the traditional and the parallel healthcare system. These doctors, nurses, administrative professionals, CEOs, cleaners, ambulance drivers, and laboratory staff, and so many others, continue to give tireless and selfless national service in a process that started with COVID-19 preparedness in December of 2019. Let's do our part. Let's continue to practice social, civic, and personal responsibility. And let's continue to practice those behaviors that have been recommended by the Ministry of Health and the World Health Organization. Thank you very much, Odessa.
Thank you, Dr. Richards. We now go to Dr. Hines for the epidemiological update.
Hey, good morning and thank you to Ms. Curley. Good morning to my colleague, Dr. Miriam Abdul-Richards. Good morning to members of the media, members of the viewing and the listening public. If we can go to the first epidemiological slide, we will look at the epi trends since the start of the pandemic, essentially. So let's go to not the next slide, but the slide after that, where we look at that first epi curve. And just as a quick reminder, the curve is looked at from left to right, left being the earliest dates back in July of 2020, when we had the establishment of community spread. The colors represent the months of the various years. So the solid colors are months in 2021. The more separated bars that you can see on the right-hand side are the months in 2022. Similar colors for the various months. So we would see that from the start of 2022, when we were just coming off of the end of that Delta-driven wave of the pandemic, and Omicron was beginning to introduce itself, we started to see a downward trend in the number of cases that were presenting themselves for care, for testing at the healthcare system, the public healthcare system. So we saw that downward trend manifest itself. We went from January and February with high numbers into March and April with lower numbers. And then we had that increase in around May. And coming down on the other side of that increase, we noted that we had fewer cases progressively throughout May into June and to the start of July. At the start of July, what we did note is that there was the introduction of the BA.5 sublineage of the Omicron variant, and that is known to be both more transmissible and to avoid or to evade the immune response. So even if you've been vaccinated or you may have been infected before, it was still possible to be infected with this virus. And the introduction of that alongside the reduction in mask wearing, because around the middle of July we removed that mandate for mask wearing, although the recommendation remains. The increased movement during that July-August holiday period, all of those things would have contributed to a small increase that we would have seen in the number of cases, again, presenting for testing in that July-August period. So the very right-hand end of the graph, you would see that we're now seeing smaller, progressively smaller numbers, progressively shorter bars, corresponding to that decreasing rolling average to which Dr. Richards would have referred, and corresponding to the now initiation, hopefully, of a downward trend in hospitalizations due to severe illness. So we are hopeful that we've run the BA.5 course, so to speak, and that this downward trend will continue to manifest itself. But in order for that to happen, we do need, as Dr. Richards said, to bear in mind the caveats, bear in mind the warnings, the measures that we've been advocating since the start of the pandemic. The mask wearing within enclosed areas, especially enclosed air-conditioned areas, whether it's in your workplace, in the grocery, in a place of worship, anywhere else that's enclosed and air-conditioned, we do recommend strongly you continue to wear your masks indoors. The hand washing, that should be a staple of everyone's basic practice, hygiene practice. Avoidance of crowded spaces, especially when ill. Not going out to work or to school when ill. All of these things are going to help to reduce the burden on the system of increasing cases. And most importantly, getting a vaccination so that even if you do happen to contract illness, your illness is shorter, it is less severe, and you're much more likely to have a positive outcome. All of these factors together are going to help us to keep the numbers low and the mortality rate as low as it can be. So if we move to the next slide, we see the same data aggregated on a weekly basis, and against the backdrop of the bars, which are the same colors and represent the same months, just now weekly data instead of daily data. We see those bars over to the right-hand side, the pink, the dark blue, and the brown, being July, August, and the start of September. So you see that upward trend in July, and now the downward trend is beginning to manifest itself. And behind that, you see that salmon or orange area that is really the positivity rate, the percent of tests that come back positive for COVID-19. And although it may be a little difficult to appreciate, for this current week, so far the positivity rate has actually only been about 23% compared to last week when it was about 38%. So again, we're seeing now that downward trend in the number of tests coming back positive out of the total number of tests done for COVID-19. It's also useful to bear in mind that there are other viruses in circulation at this time, including the influenza virus. So the public health measures that we've been advocating also help to protect against transmission of those. Also worth noting, there's vaccination for the influenza virus, and the groups that have always been warned and advised to take vaccinations are reminded so to do. Those with chronic illness, pregnant women, children in school, anybody who's in the routine vaccination groups for influenza would again be reminded that this is a good time to have your yearly, your annual influenza vaccine. Moving to the next slide, we see this same data now just tabulated. And we would see that while we were seeing somewhat of a downward trend in the last couple of weeks, we did see an increase between week 34 and week 35. Or rather, week 35 and week 36. Week 36 being the last completed week. We will see what this week brings, but we do expect that that will reverse itself and we'll have a smaller total by the end of the week. Again, just advocating that all the movement and all the interacting that we do within the stipulations of the public health guidelines. Moving to the next slide, larger aggregation of time frames. We see the same information now represented on a monthly basis. We see that we had an increase from July into August. September seems to be proceeding at a slower rate. We're at the middle of September, but we haven't reached half the cases that we had for August. So we're hoping that that indicates the slowing of transmission at this point in time. Moving on to the demographics on the next slide, we do see that that demographic pyramid for the positive cases has remained fairly stable, fairly steady throughout community transmission. Majority of the cases being in that 25 to 49 age range and being almost equally split between men and women. Whereas, if we move to the last slide, the fatalities have had a bit more of a male preponderance. That's on the next slide, the deaths. And older age group generally affected. But beyond age, as Dr. Richards would have said, we want to re-emphasize that individuals who have comorbidities and individuals who have not been vaccinated are predominant among the fatalities. So vaccination helps to reduce the risk of death. It helps to reduce the risk of severe illness, especially with those who have comorbidities. And we continue to advocate for uptake of vaccination because vaccines are available. So without belaboring the point further, I'll turn you back over to Ms. Kerr-Lane.
Thank you, Dr. Hines. Next up is the question and answer segment. We once again remind our media representatives to state your name and the name of the media house that you represent before asking no more than 2 brief questions. Please ask your questions one right after the other to the relevant members of the panel. We will take 1 question per media house in all subsequent rounds of questioning. Today we begin with questions from Guardian Media Limited. Good morning.
Hi, morning everyone. Rashad Khan here from Guardian Media. Okay, so I just have 1 question this morning. Last week, week before, we would have seen the Minister of Health hospitalized for what he says was swine flu. So now that, for me, I would like to find out what diseases do we have in circulation right now? What illnesses do we have in circulation right now? What are their prevalence? And how did the reopening and the removal of like the mask mandates and stuff affect the prevalence of these diseases in the country? Thank you.
Okay, thank you, Mr. Khan, for the question. So, as I mentioned in the roundup that I just did, beyond COVID-19, on which we have that sort of detailed focus, we do, as I just said, have the circulation of influenza in the population as well. And we are noting that the current circulating subtype seems to be more the H3N2 than anything else. And alongside that, we have some cases of things like respiratory syncytial virus, the things that normally circulate within a population. Influenza, though, seems to be one of the more dominant of the non-COVID diagnoses that are now coming through the laboratory. And with the upward trend in COVID, which is transmitted in the same way as influenza, we did see similar trends in influenza infections between about week 28 and week 36. So those are basically tied together by their route of transmission, and they're also tied together by the fact that they can be reduced by both vaccination and by the existing public health measures and recommendations. The movement that we would have seen, the openings, the reduction of the mask wearing with the removal of the mask mandate, all of those things, as I mentioned, for COVID, would have also had the same impact on the transmission of anything respiratory. And by the same token, the adherence to the public health recommendations will have the reverse effect in reducing transmission of anything respiratory. I'm hoping that covers the answer to the question.
Thank you, Dr. Hines. Next up, we have questions from AZP News.
Good morning. Thank you very much, Prior Bihari, AZP News. Just to follow up on Richard's question, do we know how many people have entry into right now in the country, and has anyone passed away within the last year of swine flu? And secondly, Dr. Hines, what are we in another wave of COVID-19, or are we still in our third wave? Can you just clarify that, please? Thank you.
Okay, I'm not sure I understood the first part of the first question. Would you like to repeat the first part of the first question, please?
Like how we know how many active cases of COVID-19 we have in the country. Do we know how many active swine flu cases that we present right now?
Okay, no, active cases, no, we wouldn't know that. There is data that is available and can be compiled and shared on the number of cases that we've diagnosed per week from week 28 to present, because we started seeing it around that point in time. So we can share that information subsequently, but it's not data that's on the table in front of me at present. The upward trend, however, as I mentioned, is a trend that mirrored the upward trend in COVID-19 during this July-August period. It may not be accurate to say that it's a separate wave of COVID-19 that we're really in. We note, as I said, that the increase in numbers, although it was a modest increase, did correspond with a few things that changed. One was the introduction of that BA5 variant, but it's still Omicron. And the other was the increase in mobility and reduction in mask wearing around the same time. So it would really constitute just a predictable change or upward deflection in numbers during the existing Omicron wave. It may not be accurate to describe that as a completely separate phenomenon. But we did have a bit of an upward trend throughout July into August, and now it's coming down in September within the larger Omicron season, so to speak, that we are currently experiencing.
Thank you, Dr. Hines. If there are no further questions, next up is TV6.
Good morning. This is Urvashi from TV6. Dr. Richards, you would have given us some information there that the CMO and the minister they are in a very important meeting with the Attorney General, and that of course piqued our interest, and just kind of wondering if there's any more information you could give us as to the nature of this meeting, if it possibly involves, public health regulations and so on. Granted that very few are still in place. My second question is for Dr. Hines. Now, Dr. Hines, I'm reading that Dr. Tedros would have said, I think it's today, short while ago that the end of the COVID-19 pandemic is in sight. I mean, you're an epidemiologist and so on. Of course, there would be a level of caution, whereas the end is in sight. We're not there yet. Any advice to us members of the public as to how, we could get over this a little bit faster? Thanks.
Good morning, and thank you, Urvashi, for the first part of the question. The Honourable Minister and the Chief Medical Officer will provide further information as required and if necessary on their meeting with the Honourable Attorney General. I now hand over to Dr. Hines for the second part of the question.
Okay, thank you, Mr. Wairupnine, for your question. I think that the statement made is an encouraging one, and as we've said, looking at our own data, we're hoping that the downward trend manifesting itself now will be one that continues, but as we continue to see, and as you rightly alluded to, the way of ensuring that we minimize the impact of this pandemic going forward is to take the public health advice that has already been given. So we are now at a stage where COVID-19 is no longer unfamiliar terrain. We know how the disease is transmitted. We have guidelines on how to reduce transmission. We have an idea of where high transmission or high risk sites would be for transmission of the virus and what steps we can take to avoid or to reduce transmission in those areas. So in enclosed areas, the mask wearing continues to be very strong advice. Not advice that is currently enforceable by law, but advice that can be followed on the basis of science. We have the hand hygiene and the avoidance of gatherings when you're ill. These things are the things that are going to help to drive numbers down. We have available vaccination. The vaccination numbers have plateaued. People have they've reached their saturation point with regard to whether they're taking the vaccines or not, but vaccines remain available, and therefore those who have not been vaccinated can still do so, and this is going to help further to reduce the rates of death and even the rates of severe illness. So all of these are the things that we can do to speed us towards that point where COVID-19 doesn't have that sort of severe and detrimental impact on the health system. So we really just need to stay the course. We know what to do. We have the information. And this is the point where we just keep applying the principles so that we can get ourselves back into equilibrium as quickly as possible. Thank you for the question.
Thank you, Dr. Hines. We now move to TTT for another question.
Yeah, hi, good morning. Sonolala, TTT News. Dr. Hines, I know you mentioned the influenza and there has been some cases. Could you possibly compare this time period with last year and see has there been any sort of increase as compared to last year, and any impact of the influenza vaccine itself? How has that been the uptake this year? And just secondly, for me, I know there has been just a couple of cases I've received from persons. There have been some cases of hand, foot, and mouth disease in schools. Just 2 cases, but is there a concern, and is the ministry aware of any cases or has any concern so far?
Okay, so with respect to the first part of the question, the number of cases so far for this point in the year, or up to this point in the year, actually does exceed the number of cases that would have been detected last year. But we do have to bear in mind that the testing was more focused on COVID-19 last year to some extent at the expense of other testing, because the resources for testing all of these viruses are shared. It's the same people, it's the same machines, and it's really whether you use them to do one test or another. So it may not be a fair comparison, but yes, the numbers that we are seeing this year, because we've now increased that respiratory panel testing, that wider respiratory virus testing, we have seen correspondingly more numbers in this time period than we would have documented last year. And I use the word documented very carefully because there may have been undocumented cases, clearly. With respect to hand, foot, and mouth disease, this is not something that is uncommon. This does happen once you have kids together in close proximity and in close contact. We haven't had specific reports come to our level yet, but the school systems generally do know what to do, and if they don't, the county medical officers of health are available to provide advice. So it's not a situation that's outside of our experience, and it's not one that causes undue concern. It's just one that causes the routine and expected concern in applying the relevant public health and epidemiological measures to stop spread in a population.
Thank you, Dr. Hines. We have another round of questions from Guardian Media Limited.
Dr. Hines, I just want to circle back to the influenza questions, right? I think Sonal asked a pretty good question there, because from my recollection, isn't the influenza season typically from October to May? So how is it that we are seeing these influenza cases outside of that season?
Okay, that's an interesting question. Influenza doesn't actually read the book on seasons, so influenza will spread once it gets into a population and there's lots of movement. We would have had a lot of movement within this, the July-August period. We would have had a reintroduction of travel, bringing things from other countries into our population in a pattern that would differ from other years. Because there was a reduction in mobility followed by a removal of those restrictions and spikes in travel at points in time that don't correspond to the normal travel periods, anything can re-enter on the basis of movement of human beings. So influenza season doesn't mean that influenza is restricted to transmission during that October period, October to December period. It just means that it is more frequently seen. And as we move into that period, there is the very likely possibility that the cases may continue to increase as there's more transmission in the colder climates and more travel from the colder climates to our country. So again, it's an opportunity to remind those who haven't been vaccinated that there's a good reason to do so. The vaccines are available, and while I don't have vaccine uptake figures in front of me to answer Mr. Lala's other question, we do know that while the vaccines are available, they may not be that that drawdown, that uptake that we would like to see, and therefore we're encouraging those who should get their flu vaccines so to do.
Thank you, Dr. Hines. If there are no further questions, there are none, we've come to the end of today's media conference. We ask that you please continue to protect yourself and your loved ones. We want to remind the public that COVID-19 vaccines are available for everyone 5 years of age and above. If you have not received your COVID-19 vaccine yet, please get yours now. Remember, the vaccines are safe, effective, free, and available at multiple locations. We invite you to visit our website at health.gov.tt and our social media pages for accurate and up-to-date health information. Finally, as we continue to roll back restrictions, let's continue to observe the 3 W's. Goodbye for now.
Music is a piece of art that goes into the ears and straight to the heart. Music is also considered the international language that crosses all barriers and unites all cultures. The Cross Caribbean Countdown is a popular fan-driven music countdown